It'll be a 50-question exam, 5 math problems. So make sure you guys have that math down and under wraps. And your study guide is going to be your best resource to use for the exam itself. Okay, so study the content on there. I'm going to go over with you guys a PowerPoint that I made that goes along with the study guide so that we can just review. And if I'm in the middle of talking or whatever, if you guys have a question, what I want you guys to do is I would like you to put it in the chat, or you can just tell me. So just 1 second, opening up our, everything's a little slow for me today. Okay, so I'm going to share my PowerPoint with you guys, and then we will take a look at that. Any questions before I start? No? Okay, coming back to you guys. Where are you? Okay. All right, so I'm going to share my screen and I will share my PowerPoint with you. So the study guide starts off and gives you topics. So what we want to remember is we're dealing with healthy people 2030. So you're going to see some information there about some things that we look at. Remember, healthy people 2030 is going to be for our idea is to make sure that we are trying to be healthy for everybody and promote healthiness among all. So remember that when you're looking for questions to answer, that's going to be what you're looking for there. So I'm just going to share in just 1 minute. I apologize. Like I said, this has been the week of my internet not working. Okay, here we go. Let's see here. All right, so here's our PowerPoint, and I'm going to show it to you and we'll go through it. So we begin in the first thing we're going to look at is going to be our rural communities. So what I want us to think about is, what do we know about our rural communities? Anybody want to throw it out there?
The PowerPoint disappeared, ma'am. Oh, there you go.
No, it came back. Sorry. I was trying to enlarge it and it went away. I don't know why. So with our rural communities, we're going to think about the type of people that are in these communities. We're going to see that we know we see poverty in rural communities. We don't see as much resources and things in our urban areas. So children highest at risk for poverty are going to be our kids, minority, single parent families, and Hispanic rate is increased the most in our rural community. Number of college degrees in our urban communities is going to be less. So I want you to think about, what does that do to unemployment?
Decreases.
Yeah, it's going to increase your unemployment rate, right? Because you're not going to have those same kind of functions going on. When we look at our rural people, our migrant workers, we know that they're working really hard. So we have the pictures here. They're bent over all the time. So we think about the demands. They're 12 to 14 hours a day on their musculoskeletal system. What are we going to see? We're going to see back pain. See the guys all bent over. We're going to see neck pain. And those are the kind of questions we're going to ask. Where is it? And does it radiate into the leg, so that we know that we can have sciatica or a herniated disc, right? Assessing a client to see whether the pain is aggravated by things such as interspinal pressure, bending, lifting, sneezing, coughing, those kind of things, right? That's going to make a difference for our assessments when we're looking at our rural communities. Sorry, I'm trying to get us out of here so we can see. When we look at our health risks for our clients, what are we going to see? We're going to see they're less likely to participate in their activities during leisure time. They're going to have decreased compliance with safety precautions. Chronic disease is more prevalent among our rural clients. And why is that? Why do we see chronic disease more in our rural community?
Because they don't.
Because they wait till last minute to go, or when it's too late to go be checked out.
Right? And yeah, I remember it. Yeah, transportation.
Yes, the lack of transportation.
Yeah, and we talked in our class about how far these hospitals can be, or, they're not gonna have an urgent care for maybe, 100 miles or so. So they're not gonna go unless they're, really sick. So in the rural communities, we also know there's a lack of anonymity among the rural communities, which is going to make reporting health issues a challenge. So we see that these people are far less likely to report sexual assault, drug abuse, depression, and those kind of things. What that means is that everybody knows everybody. So this is what makes reporting such a concern, because they don't want their neighbors to know what's going on. We see sexual assault certainly not being reported here. So we have to be real careful when we're doing our community assessments in these areas. And we take a look at our Healthy People 2030 objectives regarding our pesticides. As we talked about in my class, you're going to see those migrant workers. Primary, secondary, and tertiary. Our primary is going to be always our education. So we're going to provide the education and teach workers how to not be exposed. We're going to provide hand washing stations and conduct screenings like urine testing for our secondary. And then for our tertiary, we're going to be treating. So we'll treat those symptoms with skin irritation. Any questions on our 3 levels of prevention with our migrant workers? A hypothetical question may be something like, when caring with the migrant community, what is a secondary intervention that we may implement? So maybe hand washing stations, screenings, those kind of things. Remember, because we're trying to decrease the exposure, decrease what may occur. All right, so now, come on. All right, so we talked about this, and I'm re-emphasizing this here, guys. Chronic diseases we're going to see most prevalent, and our health status is going to be less than those in our urban communities. What we see sometimes in our rural communities is the migrant workers. So we're going to be particularly sensitive to our Mexican culture. Remember, we talked about in my class anyway, what we expect, what the Mexican clients will expect from us. They're going to want us to be the boss, the authority figure. They're going to make sure that we want to be able to relate to them while giving dignity. So we're going to do like conversation, talk a little bit about in the few first minutes of our time with them. Touching is seen as a caring gesture, so it's not a negative thing. Remember, they want like a little talk like, hey, how's your day? What's new? How's the family? That kind of thing. And that'll make them feel comfortable while you're assessing them. We look at our homeless population, one of our big vulnerable populations. Please know that families with children are our fastest growing segment of the homeless population. Single motherhood is increasing, and we see a lack of education and poverty there with our single mothers. So what do we want to do for these single moms, particularly if they're teens? What's going to be important for them?
Nutrition.
Nutrition, yep.
Education.
It's okay.
Yeah, it's important that we keep our pregnant adolescents in school. So we're going to make it as comfortable for them to be in school. We're going to make accommodations as needed for healthcare visits. But what we have seen is the relationship between education not being completed and a decrease in economic ability. So we're going to make sure chances for a better future. We're going to know that a better future is going to give us a better long-term health span. So with our adolescent teens that are homeless or not homeless, we want to make sure they're going to school. Our homeless people, we know that they have same problems accessing care as do others. Where do they go get the treatment?
Emergency room.
Yep. Anybody works in an ER, you've seen tons of these. So they go to the ER. So we know that a cost of our service in our ER is high, but it's often, but we often treat them when they come in because we kind of have to in the ER. Any questions on homeless? All right, which takes us to our HIV and our primary and secondary prevention with our vulnerable populations who may have this, this illness. So we know it's transmitted sexually between the exchange of body fluids. We know blood and infected woman to her fetus. So we're going to know that people who are high risk are going to be those people who have used IV drugs, persistent and recurrent STDs, and multiple sex partners. Okay, so somebody come up with a question you might have on something like this.
Would you ask about like sharing needles, drug use?
Yeah. Who's going to be, you know, when we're looking at our vulnerable population and HIV, who's going to be most vulnerable, right? And you guys know that because you've studied that before, but no, with our youth and our violence, we see that healthcare providers can help with those social skills, and that really helps kids to stop, think, and act. So if we're teaching social skills, what kind of intervention would that be?
Primary.
Yeah, it's going to be a primary prevention. Sorry, I said intervention. So it's going to be primary prevention because we're teaching them. And what we see is that we have then a decrease of youth violence by teaching them social skills, how to get along in the world, which is something that we really need to teach kids nowadays. Alcohol and drugs was part of our reading for this exam. So we know that what kind of medications are we not going to mix with alcohol?
Any CNS depressants medications?
Any sedatives?
Yeah. Because alcohol is going to be one and you're not going to double dose. So what's some examples of those sedatives that you could think of?
Benzodiazepam?
Okay. What else? Come on, guys, think of those
Probably
CNS.
some opioids as well.
Like what?
I was gonna say like Ativan or lorazepam or Percocet or fentanyl or
Morphine,
morphine.
hydrocodone, hydromorphone.
Yep. All of those, you know, that are going to be that are going to depress our CNS system. We're going to make sure that we tell them not to mix that with alcohol, right? So we're going to instruct our patients on that. What kind of people do we see with this kind of dependence on this alcohol and drugs? What is the overall theme that we see with them? What kind of experiences have they had in their lives?
Depression.
Yeah, mental illnesses we see for sure. We see parents, right? Genetic connections with alcoholism and drug use. We also see violence. And we see trauma, childhood trauma. It's the way that you'll see dependent clients say is that's how they cope, right? With whatever's gone on. So know those relationships there that we're going to see the violence, the trauma, the genetic connections, and mental illness. So here we take a look real quickly at primary, secondary, and tertiary with our Healthy People 2030. How are we going to help with this prevention of drug use and dependent activity? So our primary, we're going to do our community ed, right, to teach healthy lifestyle. We're going to make sure we're teaching our young kids about the use of alcohol, tobacco, and drugs. And secondary, let's do those early detection programs where we look and see, is there someone who's going to be vulnerable? Are we going to do a drug screening? Are we going to do risk surveys, behavioral surveys, seeing who's going to be higher at risk? And then with our tertiary, we're going to develop those problems and we're going to help do some therapy groups and programs to help people reduce and end their substance abuse. So I hope you guys are starting to see a trend. You're going to see examples of primary, secondary, and tertiary for different things. So always remember our primary is going to be our educating. We have no disease. We're trying to prevent it. Our secondary, we're trying to detect it or screen for it. And our tertiary, then they're already there. What are some dangers about vaping? What are we going to teach a parent who's vaping?
You get pneumonia because it's pretty much water vapor anyway. It's water. Well,
No, it's not necessarily water, our vapes.
no, I was like, it's some sort of fluid that will cause pneumonia.
It can, but what's it going to do to kids?
It can still have secondhand smoke effects on children.
Absolutely. And what else can it do?
Toxic.
Mhm,
Cause
for sure.
asthma for the kids.
Yep, asthma, and it's toxic. We're going to be teaching our parents, don't leave those vapes out because those oils that are found in the vapes can be poisonous to children. Okay, so make sure we're doing all of that. Which brings us to our congregational, institutional, parish nursing. So we know parish nursing is when we have a spiritual component to our nursing. And so congregational, we're focusing on a specific congregation. So in congregational, are you going to work alone most of the time? Or are you going to have partners that you work with?
Partners.
Alone.
Well, you guys are opposite, but yes, you're going to be working more alone. In your institutional, you're going to be going and having other people help. So you're going to have the doctors come in, you're going to reach out to community health centers. You're going to have some help there. So with congregational, you're really independent, very autonomous in your caregiving. Okay, which is something special about that. And institutional, you will still have some autonomy, but you're going to have help with other people. Okay, so I want you to know the difference and examples of both of those. We take a look at the difference between spirituality and so a person's beliefs and behaviors associated with a specific religious tradition or denomination is going to be religion right in there. And then we have our spirit or spirituality. Hold on, it says I'm unstable. Our spirituality, which is going to be just our attitudes and our beliefs towards non-material forces of life and nature. So religion, spirit, you know, everyone knows that you can be spiritual, you can have beliefs in certain things, but not necessarily follow traditions. Okay, so that's going to be something you should know for the exam, the difference between the two. All right, if we take a look at our parish nurse, what are we going to do if we're looking at healthy eating? We're going to hold classes, right? We're going to teach what for our young people who are don't have any problems with their weight right now. We're going to encourage parents to be proactive and have them do exercise programs for our healthy youth. Then we go to our secondary or screenings. We're going to see our weight screenings. We're going to do some of that within a congregation. And then we're going to have weight reduction support groups. And this is where maybe you'll have more of an institutional practice because you're going to have somebody. Any questions on parish nursing? It kind of goes along with this one too, but no. Okay, so when we're looking at our care plans and our nursing process, remember we have our, this is true for all of our nursing care, right? We have first, we're going to do the goals with our clients, and those are going to make sure that we figure out what do they want to get out of their nursing care. And then we're going to discuss and talk with them about their history as part of their assessment phase. And then we make our diagnosis, and then we plan and implement and evaluate. And so it was our outcomes will be made. So remember, we're looking at our goals and we're doing that together with the client. We're then going to have them tell us about their problems and limitations and form a diagnosis and do our ADPI. Okay, Medicare and Medicaid, this will be on your exam as well. So we know from Medicare, it has the word care in it, and Medicaid has the word aid in it. And so what I want you to remember is aid is going to be giving to people who need, and care is going to be giving to people who are either 65 and older. And know that in order for reimbursement on Medicare, you have to have a need for skilled nursing care. So caring for a new wound is going to be something good that warrants payback from Medicare. Something like helping the client dress is not going to be. Sitting with the client, not going to be good for Medicare reimbursement. It's got to be some nursing skill that's going to be used with Medicare. Medicare and Medicaid are different, like we said, is Medicare is going to be those 65 and over or possibly disabled. It is federally funded, whereas Medicaid is federal and state assisted. And the way I told my class to remember this is Medicaid in every state is something different. In the state of Colorado, for children, it's called CHP. In Florida, it's called, I don't remember, but think about anybody who's not in the state of Colorado. What's your Medicaid for kids called?
I'm in Virginia and they have several options here. There's like Health Keepers, there's Anthem Plus. We have several options they can choose from.
Good, but you have very specific names for them, right?
Yes, yes.
Which are not going to be the same as, you know, and that's how we know that it's more a state. We have some state assistance there.
Yes,
Okay.
I mean, I'm
I'm gonna
10 minutes from the
Go
North
ahead.
Carolina border and it's different for each state.
Yep, absolutely. Every and you can qualify for it, should be relatively standard, but there's some loops and holes to go through. So no, Medicare is going to be our federal program, and everybody who's 65 and over, if you ask what their insurance is, they'll say Medicare. They usually may, if they're fortunate enough to have a secondary, but so think about that. Our Medicare, you know, I'm going to re-emphasize again, we're going to need skilled professionals. They're going to generally require that, but do know that some so I just have a little chart here. I know it just sort of compares them. These are the kinds of people that we see that are the income that they need. Our Medicaid is going to be low income individuals to Medicaid if they're not, if they need skilled services that Medicare will not provide. Sometimes older people, their income is going to be. All right, we talked a bit about hospice care in my class, and I'm sure all your classes. Our primary goal with hospice care, everybody knows, we're giving care, comfort, dignity. Right? So if I were to say, what are some priorities of hospice care, we may see something like quality care, comfort, dignity, those kind of things. All right, we have 3 agencies I want you to know about: World Health Organization, OSHA, and the Agency for Research and Quality. So World Health Organization is going to do what? Who was in charge of the vaccines for COVID? Nobody knows.
The World
Yeah.
Health.
Yeah, the World Health Organization was. What else did the World Health Organization, what other things do we see it work with? We're gonna look for these, the epidemics that are gonna be worldwide, things like that. Our OSHA is gonna be our occupational safety and health. Who is that working for?
Workplace safety,
Yep. And our mission for OSHA is gonna ensure what?
Safe environment, work environment.
Our Agency for Research and Quality is going to be one of those that is going to look at the different practices that are in effect and what is important about them. Okay, so we want to know that World Health Organization is going to be worldwide, and our Agency for Research and Quality is not going to be. What each of these three do and what their goals are and who's behind each one. Okay, so we look at epidemiology. It's our distribution and factors that determine health-related states or events in a population. We have analytical, where you're going to analyze or you're going to look at the causes of a disease and deal with the determinants of health and disease. So how does it occur? Why are some people through the COVID pandemic when we were trying to figure out who and why and what? So the way I would remember analytic is you're analyzing, you're taking it apart and trying to figure out why it's happening or how it's happening. Which brings us to our epidemiological triangle. We have our three parts. We have our host, environment, and agent. Please know examples of all three. So in our host, we're going to look at people and we're going to see what they have in common. We're going to look at our females, our males. Do they have previous disease? Are they immunocompromised? What kind of religious customs? What occupation are they in? Are they married? Are they single? Their background. So those things are going to impact. Know that we have environment, which is going to be our temperature, our altitude, crowding, housing, neighborhood, water, food, pollution, and noise. And we're going to have our agent, which is going to be biological, chemical, physical, and nutrition or lack thereof. Any questions on that? Please know examples of everyone. All right, we take a look at environmental health, and it's Healthy People here 2030, but we're going to be looking at elevated blood levels in kids, risk to humans, pesticide exposure, toxics. We're looking at environmental health. Remember, we're trying to do the best for all. Those with immunocompromised or immunodeficiencies, we're going to have a bigger concern once they can have contaminated water or food. Okay, so we'll focus on those with with our contamination and our environmental health. So we look at how does our environment impact our health, pollution, sanitation, chemicals, radiation, noise, occupational risks, climate change, those kinds of things. One factor that we look at with epidemiology that I do want you guys to know is our case fatality rate. And it's exactly what it says it is. We say how many people who have a particular disease are going to be able to survive. So somebody's going to say with their case fatality rate, what's my chances kind of thing. Okay, so that case fatality, so how among our cases, what is our fatality rate? And so they always want to know that if they're diagnosed with something that's sometimes harmful or terminal. I re-emphasized here again, our contamination water, we're going to see that being a problem, particularly for those that are immunocompromised, our HIV, cancer, organ transplants, those kind of things, those vulnerable groups. I'm just going to stop sharing for 1 second. Any questions? I just got an alert, so I want to see if that's, yeah. Okay, just give me 1 second. Okay, I'm just giving you guys a couple minutes to get your stuff together. Up till this point, is there any questions that we have outlying? I'm not done, but I just want to sort of give you a break because I've been talking quite a bit. No. Is everybody just like ready for bed? I know. I'm sorry. So let me just give you guys like a minute or two to just sort of gather your thoughts and I'll be right back. Okay. I don't usually give a long break here, but. All right, any questions pop up in your head till this point? It just is giving you guys some downtime. All right, let's finish up our PowerPoint. Then we can go through maybe some questions if you guys want. So we look at what are we going to look with our environmental health? We're going to get our water supply, safe drinking, increase schools that promote health and safety, and reduce our number of days people are exposed to that unhealthy air so that we have our asthmatics, COPDers, all those kind of compromised individuals. We're going to move on to types of studies. In my class, we did an activity with this, which was helpful, but so no our ecological ones are going to be our quick, easiest ones. What they're going to do is they're just going to look at data that's there. We're going to look at population rates rather than specific things like exposures, characteristics, and outcomes. So I use this for cross-sectional study. And when we do that, we're going to get a general description of the scope of the problem. So it's going to give a cross-section of a group. So information is collected on your current health status, characteristics, and risk factors. And then we're going to see a collection of all this to see what caused those who are exposed to be diseased and those who are not. So it's a cross-section where we look across the population to see what kind of trends we're seeing. And then we have our retrospective and our prospective. And the way I told my class to remember this is remember retro usually means before or after.
Before.
So retro means like
Oh,
when you're wearing something that's retro, right? Yeah, you're going to be going sort of backwards. So what we're going to look at with our retro stuff is that stuff that's already happened. So we're going to look at our existing records, employment, insurance, hospital records, and then see they were exposed and this is what happened, followed over a period of time to see what happened. So that's going to be our retro. Prospective is we're going to see what happens over time. So we're going to do this beforehand, but I want you to remember when you're taking any exam that retro, think about retro clothing. You hear that a lot, or things are in retro. So that just means they're from stuff that's already there. We worked a little bit with occupational nursing, specialty care, and we're going to work on those prevention of health effects from occupational and environmental hazards. We're going to look at, we see them in manufacturing, industry services, healthcare facilities, construction, government. We're really looking to do healthcare and health promotion, make sure we have our healthy environment. So we're going to see an overlap with OSHA here. And there are my references. What do we have outstanding that we want to go over? I know that was a ton of information and I wanted to present it to you guys so that I covered everything I want you to know for the exam. So there may have been some extra things added in there that were not on your study guide, and I want you to know the material we covered tonight. Yes, Erica.
Our teachers will get the link to post this as well, right? I had a couple parts that cut in and out, and I just want to make sure.
Yeah, sorry. I hope they
No,
didn't
no.
cut in and out on the
I appreciate
recording.
the stuff you added, especially at the end. I just want to make sure I can review it like Monday before I take the test Tuesday.
Yeah. Yes, this recording will be on a YouTube, and if you don't see it posted, I tell my class this, you can Google my name. It's Jennifer Aloni on YouTube, and you will see the exam review as well.
Thank you so much.
Okay, so just anybody who needs that. What I'm gonna suggest to you guys for this exam is, and I give this test taking to all of my students, don't second guess yourself. If you don't know the answer to a question and your first gut is answer A, then go with A. Because 9 out of 10 times, if you change it, you're changing it to the wrong one. Okay, so just a bit of advice, and take that with you for the rest of your nursing career, because that will be true on almost every test you take. I will tell you, I sat for my NCLEX many moons ago, but I had 75 questions. And what I knew from 75 questions is I answered that answer and I go forward. Because the more you think about it and say, well, what if this was that? And what if this homeless person, you know, maybe they didn't share needles. Like, I mean, you just don't go back and forth like that, right? You've got to just take it for what it is. So a lot of information here tonight. And I know there's a lot on the exam, but like I said, that study guide is really helpful. Is there anything else you guys want me to go over?
Can we please go back to that retro and prospective?
Mm-hmm. Sure. So when we think about retro, this is how you remember what retro is. This is what I told my class. If I say the word retro to you, Diana, what does that mean to you?
Can you say it again?
Sure. What's the word retro mean to you? When somebody says something's wrong, what does that mean?
Like retrograde, like it's the
You know.
opposite of something. Like if I stick a needle, it'll be opposite of something.
That's not really retro. When you're thinking retro, you think of like old fashioned, or like a lot of people say like the 70s clothing is retro, right? You know, kids are wearing bell bottoms all the time now. It's called retro clothing because it's from back when, the 70s. They have the same outfits. If you look at somebody in the 70s, I am fortunate not to be that old, but I have seen plenty of pictures of the 70s and know what they wore and knew all that, right? So if you look now at kids in high school, they have the same bell bottoms, they have the same shoes, and it's called retro clothing. It means back, it happened already. So with retro studies, it's happened already. So the information is from pre-existing stuff. And then prospective, you're looking pro, which is going forward. So that's something that like you may be like seeing as it's going on or before it happens. You know, so you'll do it like, for example, with a prospective study, or we could do a retrospective study on COVID, and we could go back and look at our hospital data, and we're going to say, these are the people that had it, these are the people that were hospitalized, and this is the outcome. If we were going to do it more prospectively, we would interview everybody who comes into the doctor's office, right, before they even have it. So it's going to be new data coming. Is that a little clearer? So I always use the example of the clothing because I want you guys to apply things that are going to help you remember. So, you know, it's hard to remember all this stuff. I know that, and I feel for you. So I like to use like tricks like that.
Thank you.
You're welcome.
I have a question.
Please know the different types of studies. Yep, go ahead.
I'm gonna try to ask this as easily as I can. That's kind of a weird question. So our NCLEX questions we had to do this week, I felt like were really like med surge geared, and I didn't feel like they pertained a lot to like our information that we had in lecture in our book. Should we be expecting more questions like that on the test, or is it more like?
I will
when I
tell
think
you,
of-
your HESI is going to be written that way. Your HESI will run that way.
Okay.
For exam number 2, it's a lot of case studies. Like our rural health nurses, blah, 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 blah. Like, you know, what are we looking for as a role, that kind of stuff. But I will tell you, I want you to know those CNS meds. And because you don't want to mix them with alcohol.
Thank you.
Sure. Remember that community, and I know this is why it's a hard class sometimes. It's not these conditions and the symptoms and the treatment, right? You have to blend everything together to get an outcome. So that's where it gets a little more, not as, you know, as nursing students, we all want to study like the condition, the side effects, the treatment, you know, that stuff. And community is a little more vague like that because we're dealing with so many different things. Anything else I can help you guys with?
A second ago, right before her question, you said no, the something something, and I missed what that was.
No worries, CNS depressant meds.
Before that, it was, oh gosh, I wish I know what you said. It was an example of something. I'll go back, I'll review. I'll figure it out.
Sorry, I don't remember what I said. I think the best thing to do is, I mean, we have some Kahoots that we've done in my class. You guys probably have done some in your class. They're good to do, they're good reviews. I would focus on the content that's on your study guide, and use those as sort of a supplement. But they're really good because they cover a lot of what's on the study guide too.
Do you post the Kahoots anywhere? 'Cause my teacher doesn't do those and I have a hard time finding them, but I feel like they really
So
help
I
me
don't
study.
know that we're allowed to post them. My class had asked me the same thing. I don't know that we're allowed to post them. What I tell my class is watch the class and when we go through the Kahoots. But I can send a text right now to Dr. Lundy and ask her.
But we could find your class on your YouTube channel and just rewatch your lecture.
I would fast forward it, or else you'll have to listen to me for 2 hours. So just fast forward till the till the end where the Kahoots are.
Thank you.
Mhm. But if I can post them, I will, I'll post, trying to think of how I could do this so everybody has access.
Dr. Lundy emailed us hers, so fingers crossed.
She did email you.
I have
hers.
Dr. Lundy and I haven't received any Kahoots from
Or
her.
I think it was an announcement. I can look right now. I'm in her thing.
So she's sharing it. She's the lead in our course, so I feel like if she's sharing it, but
Yeah, I'm in Marvel's class and I have 2 Kahoots already posted from week 4 and this week.
so do they post the link or how do they post them?
She did. She put it, if you're in Dr. Lundy's class, it's under week 5 recording from lecture held today, 11/1/22, and it's the very last link she posted.
Oh, okay.
it's
So
a
I have
Kahoot
her on
link?
Fridays, so I haven't had week 5 yet. So that could
Okay,
be
I'm
why.
sorry. So you guys will play it and she'll post
Okay,
it.
perfect. Thank you.
Okay, but she only posts the ones you play in class.
Typically, unless we ask her, sometimes she'll post other ones, but we have to
Yeah.
kind of,
I don't, because there's so many out there that I would, so for my class, I will post the one we did this past week. If you guys want it, I'll send it to you guys in an email link, okay?
Yeah, ours doesn't really say like exactly because we don't play them in class. I'm in Marvel, but she just posts this. I'm not really sure who does them, but they're on there. They're posted. Like it just says week 5 Kahoot activity. And then
That might
there's,
be
like, a week
something
4
she's
Kahoot
doing
activity.
individually. That might be something she's doing
Yeah.
individually.
Did you get everybody's names so you have our information to send
I
us?
did, yep, I got it all in there. If everybody put it in there, I got it copied and I'm good to go, so.
I didn't.
All right, guys. You don't see your
Oh.
name in there?
I was gonna
Uh-oh.
say, so I went to the link, like, there's like, it's in the announcement, and then it's YouTube at the top, and then at the very bottom, there's says create Kahoot it, and then I just like went to the link on that, and it shows me all of the Kahoots from week 1, and like you can play it by yourself.
Okay, I'll list them, what we're sharing.
It's on that week 5 prepare.
Who's your professor?
Professor Price.
Okay. All right, so I did Kahoot for week 5 this week, so I'll post that for my class because we did that together as a class. So that's, I think that's probably personal preference on the professors, but. Any other questions?
Where are you gonna post the Kahoot?
I'm sending it to an email to my class.
Or just to your class?
Yeah, I would reach out to your professors because I use the Kahoot week 5, so that's why I'm sending it to them. You know, I don't want to randomly send Kahoots. I could be honest with you, if you go to Kahoots though, and you search whatever topic you want, there's like 17 billion of them out there. You know, and ours are not written, you know, specific to just Fortis. They're general information. All right, so guys, thank you for joining. Please make sure that you listen to other ones. And if you guys need anything, reach out to your professors and I will be posting this as a YouTube in just a little bit. Okay.
Thank you. Have a good
Good night.
night.
Good night. Good luck.
Thank you.
Good night,
Thank you.
Professor.
Thank you so
Good
much.
night.